Morning and welcome to May's Medicare Monday. And for this Medicare Monday this month, we are doing Ask the Experts. So we realized we haven't done one in a while. And we thought, you know what? People probably have some questions about Medicare, and we are the experts for that. I would say maybe Susan. I need a t-shirt that says, I'm with the expert, right? Or a mug. That would have been even more convenient. But all jokes aside, we are here to answer your question. So I am joined by my lovely co-host this morning, Miss Susan Spilly. Good morning, Susan.
Good morning, Melanie. Good morning, everyone. Thanks for tuning in this morning.
Absolutely. So we are standing by. We've got our chat open here to answer your questions on Medicare. Now we are not experts on everything, so we do have to stick to the Medicare topic. And I don't see any just yet, Susan. So maybe we can just kind of start with some commonly asked questions, some FAQs, if you will. Not to put you right on the spot, but do you have a common client question that you hear a lot that we maybe kind of open the doors with this morning?
Yes. Do I have to sign up for Medicare when I'm 65 like everybody tells me I have to? And
That
that
is
question is posed by people with all different kinds of backgrounds and education. And, I always say there's big three. If you're actively working for a large employer, which means 20 or more people for the 65 and over crowd, and you have credible or creditable health and drug coverage, you do not have to sign up for Medicare at age 65. And it will be there waiting for you when one of those three things stops being and you need to sign up. So that's really the question that I think is the most frequently asked question to me. So what about you, Melanie? What do people ask you?
Well, I was going to kind of go along with what you just said. A big follow-up question to that is, well, do I have to tell them anything when I turn 65 if I'm not going to take it? And so if they do have those reasons that you just listed where they don't have to take it, then you turn in that proof and the forms will be waiting for you, like Susan said, when you're ready to start Medicare. So that's a big question I get is, do I have to do anything even if I'm not planning to take it? And so most of the time, no. Now, another time where you may be 65 and you may be on Social Security and you're getting your health coverage through your spouse's active employment. Now, that is where you will, in most cases, be auto enrolled into Part A, but then that's where you can delay your Part B. So that would be the only time you would actually have to do something is mailing back that Medicare card to delay your Part B. But all of those questions and those situations, that's what's so great about SHIP counseling, in my opinion, is that we do have counselors and sites, statewide where you can call our help center, and get those quick questions asked, but you can also just sit down with somebody to ease your mind too, because it's kind of a big fear. Everyone's afraid of those penalties, so to speak. So kind of want to make sure that we get those going. Um, a common question I get, and it's always, kind of one of my favorites to answer is, well, what would you do? An Advantage plan or a supplement? And it's like, well, we can't tell you what we would do. We can't give you our advice, but we can give you that impartial comparison of how the two coverages work differently, how that may affect your health coverage, your access to health coverage, your pocketbook, all of the things to consider so that you can make that informed decision on an Advantage plan or a Medicare supplement.
Right.
And then, yeah.
I always throw in there, every insurance decision you make is going to be based in part on your tolerance for risk.
Absolutely.
Whether you want to pay more upfront and have less out of pocket, or pay less upfront and run the risk of something happening, and then you do have out of pocket expenses. So it's just like car insurance or homeowners insurance. That is one thing to always factor in. And that's why it doesn't really matter what I decide to do with my Medicare, or your neighbor or your friend or even your spouse, because you may have different ideas about risk. You may have different health conditions. So I always throw that whole risk tolerance thing in the mix when I talk to people and try to answer that, or try to get out of answering that question.
I like that description. I do. I think I've actually stolen that from you a couple times. So I do like that. But it is, it is, you have insurance to kind of reduce your risk. And so it is. It's about what your tolerance and sometimes what your budget can afford you too. Sean asks, hi Sean, good morning. Thanks for watching. She asks, or says that she often gets asked what the difference is between original Medicare and Medicare Advantage plans. So that perfectly kind of goes along with what we're talking about. And a lot of times I start those conversations with, that's kind of your first choice, when you're starting Medicare, or even during the open enrollment period, if you want to stay on the original Medicare, or if you want to have your original Medicare provided through a Medicare Advantage plan. And I always kind of just describe it as, Medicare Advantage plans are Medicare's version of managed care. So it is, a private insurance company providing the same benefits that Medicare does, but things can be different because they are managing your networks of providers. They're managing and approving your services, your need for services, I should say. And then in most cases, they also can manage your Part D, your prescription drug coverage with Medicare. So it's a private insurance company managing your benefits, where with original Medicare, it is provided through the federal government and it's nationwide coverage, as if you're going to a provider and Medicare approves that service, it is it's available nationwide rather than in a private insurance company's network. So there's few more differences than what I just kind of illustrated, but what we can do in a face-to-face appointment is we can kind of describe, we'll talk to you about your health needs and what you're looking for, and making sure that you understand how the two affect. And sometimes it comes down to cost. With Medicare, you do have the original deductibles and copays, where with a Advantage plan, you may have different deductibles and copays from what the Advantage plan company offers, and that could affect your choices as well. So we can talk about how that kind of plays out. Anything
Yeah.
to add there, Susan?
Yeah, along with talking about it, we can use the Medicare.gov website. They have a terrific tool that
Mm-hmm.
explains all about your options, and we can look at specifics. Like
Mm-hmm.
if you want to look at Advantage plans, we can find Advantage plans that serve your area. We can help you look to see if your doctors are covered at the time. Even boiling down to how well or poorly they cover your prescription medication that you're on. We
Right.
can also help people look at Medigap plans, which are supplement policies that you purchase from a private insurance company
Mm-hmm.
that works with original Medicare A and B. And we can get you some cost information. We can help you look and understand all of the data that's in our search tool. And that's, super easy, just done right from our website at Indiana Ship. So those are ways that we also help people kind of give some more thought to their options, which are generally Medicare, original Medicare with a GAP plan, or a Medicare Advantage plan. So lots of ways that we can help you with information for you to make those big decisions, because that's really what stresses people out. Which way to go if you're new to Medicare. And just as a reminder, We're going to be talking about these things and all the other things about Medicare at our webinar, not a Facebook Live, it's a true webinar on May 23rd in the evening. So tell your friends and neighbors to tune in. You can register for the event on Eventbrite. And of course, it's free. And you'll see us talking about being new to Medicare and all the things to consider.
Yes, absolutely. And we have that promoted on our Facebook page, so they can get that link directly on our event on our Facebook page. So we would be happy to have you. Little plug there. Okay. Oh, I just got a question here from Jerry Shepard. He says, can I switch back and forth between Advantage plans and Original Medicare? Well, that's a great question, Jerry. Susan, I'll let you start us out and then I'll help you.
Yes and no, Jerry. Couple of things come into play there. So when let's say you go into the year with an Advantage plan, and you do have the first 3 months to check that Advantage plan out. And if you don't like it, you can drop it and return to Original Medicare. That's A and B, and pick up a drug plan. After that, unless you are receiving assistance from the Medicare Savings Program and extra help, you will be enrolled with your Advantage plan for the rest of the calendar year. So there are other times when you might be able to change or drop Advantage plans and return to Original Medicare. And that's if you permanently move out of the Advantage plan service area. Another thing that in my 15 years with SHIP, I can only recall this happening once, but oh, it was like a bomb dropping when an entire Advantage plan just quit. They gave their members some notice, but not a lot of notice, and they just were going out of business. And so we helped as many of their members as we possibly could look at options. Now, in that instance, the people's options were changing to another Advantage plan or having a guaranteed issue, a special enrollment period to buy a Medigap plan. And so I know some of the people that I saw said, well, I've got some health conditions that are pretty costly. I think I'm going to get a Medigap plan now. So just understand, Jerry, that leaving an Advantage plan doesn't necessarily, and quite frankly, rarely gives you a guaranteed issue for a supplement plan. And there are very few people who only have Medicare Parts A and B because there's deductibles, there's co-pays, there's co-insurance associated with A and B that can really wipe out any kind of savings that you have if you have a tragic illness or so there's no safety net there. There's no maximum out of pocket. So while Medicare is fabulous coverage, it's not the be all and end all, and service isn't free. So very few people only have A and B. So there are times when you can drop your Advantage plan and go back to A and B. But sometimes it just depends on your situation. And any SHIP counselor you would talk to would ask you about what else is going on if you meet the other criteria to where you could drop and pick up something else. So did I leave anything out, Mel?
I don't think so. A question I get that kind of goes along those lines seems like it's during fall open enrollment every year, is kind of like what Jerry asked. I have Original Medicare and maybe this person has a supplement with their Original Medicare and they're considering an Advantage plan. And so that's a question I get a lot during the open enrollment period. And I call them exceptions to the rule. So typically, when you do switch from Original Medicare with a supplement, and then you are thinking about an Advantage plan, there are some certain, considerations to make there. And some folks that ask that question, they've always had a Original Medicare with a supplement. So The exception to that rule is called a trial right in Medicare terminology. And that allows someone to try out a Medicare Advantage plan for 12 months and then being allowed to go back to their same, it's not a shopping period, to go back to their same Medicare supplement. But it's just a 12-month period that they can do that. So it's a trial right. I call it a trying out period. Um, so that is kind of one of those exceptions to the rule during the follow-up enrollment period. If you're kind of curious on the Advantage plans, knowing that you have that security blanket where you can go back to your Medicare supplement. Now, I say that, but what we mean by that is that you're guaranteed accepted back into your same supplement plan. So that doesn't mean that later down the road, if you want to switch and you want to look into purchasing a supplement plan, you can do so. You would just not have guaranteed issue rights, so to speak. So that would allow the insurance company to do the medical underwriting that asks the medical questions about your medical history, your current diagnoses, medications, and just doing an overall review on you medically, kind of looking at their risk, I guess, for covering you. And then they can base their, their premium and your acceptance into the plan off of that underwriting. So that's kind of what we mean when we say, you're guaranteed to go back to that plan. You can always look into a supplement. It's just you have those special um, entrances without having to go through the medical underwriting. So
Right.
that's something that we get asked a lot. And, it's commercials, you're getting lots of mail at this time. And there are a lot of things that are enticing about both sides, of a supplement and an Advantage plan. So, kind of trying to figure out which one best fits you. It is nice to have that 12-month period to figure it out, so to speak.
Right. And so just to recap that, it's for people who, when they were first eligible for Medicare, when they first signed up for their benefits,
Hmm.
purchased a Medigap or supplement plan and have had that. Then they have a 12-month period for a trial right to try out an Advantage plan for up to 12 months.
Right.
But there's also another trial right, but
Yes.
this trial right comes with another stipulation. So it kind of is the reverse of that. So if
Mhm.
at age 65, and that is the difference there, at age 65, when you were becoming, or when you were first eligible for Medicare and you signed up for an Advantage plan, you have 12 months, so that 65th year going into age 66, to still drop that Advantage plan and purchase a supplement with guaranteed issue and a special enrollment period. But remember, that's for folks going on Medicare at age 65 and signing up for an Advantage plan right out of the gate.
Mhm.
And as time goes on, and certainly as Social Security has increased their age range for full retirement benefits, I see fewer and fewer people actually retiring and needing their Medicare at age 65. Most people are kicking that can down the road. And I always tell people, age 65 is awfully young to retire, and 65 gets younger every year to me. And one day it will to you too, Melanie, when you get closer to it. And, most people are working well past that, because when Medicare was first thought up and enacted, people were only living until they're 70, 75. Uh, so 65 used to be old, but now it's young.
Absolutely. Well, Jerry gave us a follow-up question. So Jerry says, I'm under the age of 65. So would that make a difference? No.
Okay. Yes. So if you are on Medicare because you're on Social Security disability, then when you turn 65, you can have a big old party, and you can buy any Medigap plan available to you in your state. So without any medical underwriting. So if you are, as we say, aging into Medicare, having been on it before, it's like you're a new beneficiary all over again, and you have all the choices of people receiving Medicare just based on their age. So you probably, Jerry, have an Advantage plan now because that's the only really more full coverage option to you here in Indiana. But whenever it is you turn 65, then start from scratch and the world is your oyster.
Absolutely. I love that answer. Okay, we have another one that came in from Judith. Hi, Judith. She says, is it true that Medicare Advantage plans can disallow certain rehab facilities that you may have chosen?
Well, that's all about the whole network thing.
Mm-hmm.
I disallow, I don't know if I would use that term. I would just say with managed care, and this can be a PPO, an HMO, a special needs plan, you know, any kind of managed care. It's how they contain their costs and manage your care and the costs that those services charge is to basically contract with certain providers of services because they, you know, those certain providers of services, they can say, okay, give us the best deal, give us the best rate, and we will put you on our list and our customers will use your services. And so they're able to negotiate best rates to be able to contain and manage costs and manage care. So one of the complaints that I do hear about Advantage plan holders is if they do need to go for short-term intermittent rehab under Part A of Medicare, and they're on an Advantage plan, they may, depending on where they live, have to do some extra looking for rehab places, nursing facilities that are in the network of their particular Advantage plan. And so providers don't have to be in networks. The government doesn't make them. And so they can say no to this network, but yes to these other 3 networks. If you're in a small community, you probably don't have a lot of nursing facilities available to you. So sometimes that's when you might have to go out of town. And most people, you know, they don't like to do that. So that is one of the things that you have to be aware of when you have an Advantage plan or any network driven insurance.
Absolutely. And we mentioned the Medicare.gov earlier, where you can go and look at Advantage plans. And when you do look at Advantage plans, you can easily access their website and kind of look up provider networks that way. So when you are, looking and shopping for a Medicare Advantage plan, it's a really good, helpful tool to use. And our SHIP counselors can assist with that and encourage when you are looking into an Advantage plan to check existing providers. But if you are got an upcoming surgery, I always use like a hip replacement as an example. If you have something coming up that you expect to be inpatient for a couple weeks, it's always good to kind of check that as well. If because we all do have places we've heard great reviews on and that we prefer to use, or we have established doctors in that same way that we want to continue to be in their network. So that's something that's a really good thing to check. And it's a good thing to check actually every year. So during the fall, when it is that open enrollment season for Advantage plans and drug plans, it's a good idea to just kind of check your plan, and you can even check its competitors, so to speak, just to see if there's going to be any changes in the following year. And some of those, changes can be networks. So it's always good to check that. And throughout the year, if there are network changes of your plan, you're supposed to be notified. Susan, correct me if I'm wrong, but I think it's a 30-day notice that you're supposed to get if there's been any network changes, so that you are aware of that. So, okay. Now, Jerry has asked us another question. So, hi, Jerry. And he just is following up again with his original. He wanted to say, or he's saying, so Medicaps are not available for people under the age of 65 with disabilities.
Well, Jerry, assuming you're a Hoosier and you live in Indiana,
Mhm.
There are each insurance company who sells Medigap plans in Indiana has to offer a Plan A supplement or Medigap plan. But Plan A is the most limited coverage of all the supplement plans. But there is medical underwriting. So that means that you can say, oh, hey, I want to buy a Plan A supplement, please. That insurance company will certainly look at your medical conditions, and then they will price your plan accordingly. Or they can just say, no, we're not going to sell you a plan. And so for the benefits that you get from a Plan A supplement, which are the most minimal, it's often cost prohibitive and not really worth the money of a monthly payment. I mean, I've heard of monthly premiums being $700 or $800 because of someone's medical situation. And it just kind of goes to thinking that if you are receiving Medicare because of a disability, you likely do have conditions, disabling conditions that require medical care, and they are still allowed to look at your medical when you're under 65. So technically, you could purchase a supplement Plan A, but they would medically underwrite you, and that would likely be cost prohibitive.
Yes. So the silver lining to that is we try to help you pick an advantage plan that would give you, the good coverage and helping you making sure that you have access to your health care by checking those providers and things like that. So good question. And Jerry did mention that he was in a rehab center, and had to switch Advantage plans for that coverage. So you have learned, you have learned how those networks and providers can coordinate. Okay, we're gonna move on to Sean. She has a question in the chat here. I had a client tell me last week that she's been on a supplement for years, and the premium increases are hardly affordable, and she's thinking about changing to a Medicare Advantage plan. How much can Medigap premiums increase each year, or expected to be increased to? Whew. Okay.
Right. Well, that's up to the company that offers the plan, and it's
Mhm.
up to the Indiana Department of Insurance, because
Mhm.
the Indiana Department of Insurance approves or denies or modifies all rate issues with any kind of insurance sold here in Indiana.
Mhm.
Um, so, your cost is not going to be the same when you're 85 as it was when you were 65 and first bought that Medicare supplement plan. But if I had a client that brought that up, I would do a couple of things. I would suggest that the client contact her insurance company to see if she could buy down to a lesser policy. So if someone is older, it's likely they have a Plan F supplement, which are no longer sold to new Medicare beneficiaries, but they still exist in the hundreds of thousands across the country, because it used to be the most popular plan and everybody had a Plan F. But Plan F have become more expensive because they are the Cadillac plan. And so the next one that offers some almost just as good a benefits as Plan F is Plan G. So there would be nothing hurt if you would just call and say, how much would my plan premium be reduced if I were to enroll in a Plan G supplement? And they could say, oh, it'd be this much, or they'd say, no, we're not selling you a Plan G, because remember, they don't have to unless they're in a guaranteed issue period. But it's always worth a phone call. The other,
Absolutely.
the other thing that I would do is, if it were during open enrollment, of course, or maybe start now to kind of get some idea, is to look at their drug plan. Oftentimes we see people who've never looked at drug plan alternatives, and they're paying $100 a month for a drug plan premium where there's one that's much cheaper. And so, no, we couldn't help to do anything on the supplement monthly premium, but look here, we saved, $95 a month in a drug plan premium because that drug plan was too enhanced and therefore too expensive for their drug needs. So it's kind of like, getting help on this end won't solve all the problems, but it could alleviate some of the monthly budgetary challenges. And then, moving to an Advantage plan is always an option. I do have a friend who asks me every year during open enrollment, now, why am I paying all this money? I want one of those Advantage plans like I see on TV. And I say, well, you can have one. We can look at options. Just remember thus and such. And for her lifestyle and how she approaches her medical care, she has thus far remained on a supplement plan. So those, that's kind of the answer to your question. The other thing you can do is to go on our website and look up Medicare supplements, and on the search tool, once you bring up the plans, there's a little tab called Market Analytics, and it gives you some information about historical rate increases for these companies with these particular plans. So whether history is an indicator of the future, like in so many other things, it's a piece of information. And if you're a data-driven person, then there's all kinds of data on the Market Analytics tab. And a SHIP counselor can help you get there if all those tabs are too confusing for you.
Yes, absolutely. So there's always ways to access more information, and sometimes, yeah, it's not necessarily the supplement that could be driving up, or the only thing driving up those costs. So we do try to look at the whole picture. And sometimes it's just having an understanding. I had a client one time, he had a plan G and he was done with it. He was over it. He told me it didn't cover anything and he had to pay every time he went to the doctor. Well, as we sat down and we talked about it, it turns out that the one thing that Plan G does not cover is your annual Part B deductible. So that would be one of the services under Part B is your doctor's appointments. And he went to the doctor maybe once or twice a year. So he never met his deductible. So he thought he was paying for something that didn't cover him. But as we sat down and he understood the coverage and what he was paying for, he made the ultimate decision to stay on it. But it was just kind of like your friend Susan, it's every year we get those commercials and we get that information, and you just worry that maybe you're not getting something that you need or getting something extra that you can have. So sitting down and looking at that whole picture, we're definitely experts in that.
Yeah. And we do understand, nobody likes to pay insurance premiums and not get something back. Now, we don't want to be sick, so we have to use a lot of insurance, but it's like paying your homeowner's insurance. Well, my goodness, who likes to write that check? But you're appreciative of it when you get a hailstorm and you and all your neighbors get a new roof. But no one likes it, but no one likes to pay a monthly premium and feel that they don't get anything out of it. But you don't want to get sick. You don't want to get in a car wreck for car insurance, and you don't want to have a hailstorm where you have to get a new roof for your homeowner's insurance. It's just the nature of the beast of insurance, I think.
Absolutely.
So, yeah, but I'll go back to Jerry's or Sean's question about her client too. Is Melanie, you and Sean and I have a coworker who's been on Medicare for several years, and I think she's changed her F plan 3 times and gotten a better rate. Now, she doesn't have any significant health conditions, and so she was able to change. And because they thought that they, it'd be okay to sell her a policy. So it's not that you can't, it's just that they don't have to sell you policies, but it also doesn't cost you anything for asking.
Absolutely. And Sean, she said that's exactly what happened with my client when you were talking about looking at the drug plan coverage and checking the premiums that they were paying and the coverage of that plan versus others. And she said that when she met with a client, they came in concerned about the Medigap Plan G increase, but actually Sean ended up finding her a different plan that saved her $1,200. So Sean, I think you would be in the competition there for helping clients, and we like to compete to see how much we can save our clients money. So I think you might be up there, Sean.
Yeah.
Okay. Well, Jerry, he says that his Advantage plan has some preventative dental benefits. Does original Medicare have better dental coverage? Well, I can answer this one. So, dental coverage is not a covered benefit of original Medicare. And so, along those lines, dental, vision, and hearing, two of those big threes, are not covered by original Medicare. So Medicare Advantage plans, they are allowed to offer extra benefits outside of what original Medicare covers. And so a lot of them do offer dental coverage, and it can vary depending on the plan. There can be preventative and comprehensive dental coverage. The amount of coverage can differ from Advantage plan to Advantage plan. The networks of those dental providers can vary from Advantage to Advantage, and what you pay, what your out of cost would be versus what the plan would cover, can vary as well. So it is something that most Advantage plans do offer as an additional benefit that you would not get through original Medicare.
People do ask me this question, if they have decided to go with original Medicare with a Medigap or supplement plan. Well,
Yes.
where do I go to buy dental insurance and
Yes.
optical insurance?
Mm-hmm.
So what's your answer there, Melanie? What do you advise your clients?
Well, I have a couple different things that I have them look into. The first thing is if they are going with a Medicare supplement, I'll ask them to contact that company and see if they offer a rider, which is just an additional policy that they can purchase for dental or vision coverage or both. The other thing is I will tell them, that there are plans that just offer that. And they can look into that as well. And so we'll usually try to kind of look into the area that we're at. We'll look at some of those private, offered plans. We all see the commercials, Physicians Mutual has the dental coverage and, the different places. And then sometimes it also comes down to that risk thing again. It comes down to if you do want to buy that policy or if you do want to go to a place where you're comfortable paying cash, paying out of pocket for that. There are a lot of options for, eyeglasses and eye care and dental care that you can, access without insurance as well. So we just kind of have a kind of depending on the situation, we just kind of talk about all the different options out there. But it is always something that's asked, I would say, probably about 90% of the time. What about you, Susan? Anything that you discuss?
I discuss exactly those things. And I also, if they are thinking they just might want to, roll the dice, I
Mhm.
always say, ask your providers if they offer a cash discount. Many of
Right.
them do, because then they don't have to file insurance claims and pay their staff to do that.
Mhm.
The other thing is, I live in Indianapolis, so I have access to a dental college. So
Yep.
I know my neighbor gets all of his oral care at the IU School of Dentistry, and that
Yes.
works well for him. Um, so, sometimes those are options as well. But right now, no dental, but there have been discussions over the last
Mhm.
couple of years of incorporating some basic dental care under Part B of Medicare. That's going to be pretty costly to the taxpayers, so it really hasn't gotten a lot of movement on the Hill, but the advocates are still fighting for that because I think we all understand that our dental health is part of our
It is.
medical health.
Yeah.
Mhm.
We too have, I didn't think of that earlier. We do have a university in Evansville as well that does the dental college where you can go, and I know some health clinics or dental clinics, they may have like that sliding scale or a discount for dental coverage too. So there is some options, and your ship counselor. The reason we do have ship sites and counselors all throughout the state is because they know the local areas, so they can also, just like Susan and I are sitting here like, oh yeah, we have this and we have that. Your counselor in your area is going to be just the same with the resources available. Okay, so Rose asks a question. Hi Rose. Are there marketplace, I'm sorry, are there market plan advantage plans? I think she means marketplace, and would they be cheaper than others because of income?
So Rose, are you asking about the healthcare marketplace, the Affordable Care Act marketplace plans?
I think maybe seeing if there's advantage plans available on the marketplace.
Oh, well,
I haven't seen her type back
marketplace
in yet.
marketplace plans are not advantage plans because advantage plans, that is specific to people with Medicare.
Mhm.
Almost all people who get their insurance through the marketplace are not eligible for Medicare. There's one tiny little population that can still access a marketplace, even though they're Medicare age. But generally speaking, you choose either Medicare or marketplace. But marketplace plans, just by the nature of the type of insurance, are more of a PPO kind of situation. You have your choice of insurance companies. Within those insurance companies, you have your choice of certain plans. They're called silver, bronze, platinum, I think.
Mhm.
Um, and those are just all dependent on the services, not the services that you get, but your premiums for sure, and the deductible amount. So the
Mhm.
bronze is the cheapest premium, but the highest deductible.
Mhm.
And every insurance company who offers insurance to the marketplace in Indiana has the array of plans you can choose from.
Mhm.
Um, Ship counselors are by and large not healthcare navigators. Now, we do have some that are dually certified, and most of those folks work for hospitals or health centers. They have dual certification as a navigator, a marketplace navigator, along with being a ship counselor. But just your run-of-the-mill ship counselor like Melanie and me, we are not navigators. I only know about the marketplace because well, I've been doing this since before 2010 when it came into being, and I have received insurance through the marketplace several times. So we can always refer you to options for navigating services because they'll tell you all about the marketplace, just like a ship counselor will tell you all about Medicare and its options. Rose, if that
Absolutely.
really wasn't your question,
She s- she
oh,
said
okay.
yes.
All right.
She said yes. She's still with us. And just, just to kind of add to that is, generally speaking, if you are on marketplace and you become eligible, for Medicare, just marketplace insurance is considered secondary coverage to Medicare. So usually it's not going to be a reason for you to delay your Medicare coverage start date. So you would usually go on Medicare and go off of your marketplace coverage. Now, she was also kind of asking, um, which we do know that some advantage, or I'm sorry, here I go mixing them up. Some of the Affordable Care Act, marketplace plans, and again, we're not experts on those, but we do know that there is, some tax credit, or based on your income you could pay a lower premium. So she's, I think, maybe kind of going along the lines of that with Medicare Advantage plans. So I'm going to kind of take that into a different direction, or a similar direction, is with Medicare, there are programs, and Susan, I'll let you continue this here, but there are programs called Medicare savings programs. And this is based off of your income and your resources, and it can help pay some of your out of pocket Medicare costs. So, Susan, I'll let you take it from here.
Right. Well, thanks, Melanie. And I just happen to have a little brochure right here that we're happy to mail you if you call and ask. There is, like Melanie said, the Medicare Savings Program, and there are 3 levels of those, depending on your income. So it can pay, all 3 levels pay your Part B monthly premium. So that's almost $175 right back in your Social Security check, or in your, not coming out of your bank account.
Mhm.
The one that pays premiums, the drug plan or the monthly premium, it pays that 20% co-insurance. It pays any kind of co-pays associated with Medicare, is called QMB. And for QMB, your income limit is $1,903 if you're a single person. For the plan that pays the monthly premium, and that's all it pays, but it's still $175. Your income monthly, the limit there is $2,342. Now, for both of these programs, your assets are $9,430 for a single person, but that doesn't include your home or your car. Sometimes some trusts and annuitized retirement accounts don't count towards that resource limit. If you have prepaid burial plans, that doesn't count. Your personal possessions don't count. So again, call to a SHIP counselor and we can help you kind of flesh that out a little bit. And we can also help you fill out the form to apply for those programs. So single person, $2,342 gross income a month. $9,430 in assets. Also, if you're still working, we only count half of your wages towards that monthly income limit. So that's something to think about too. There's another program that helps you cover your prescription drug costs, and that's called Extra Help. That income guideline is consistent with QMB at $1,903 a month, but they do allow you to have more assets. A little over $17,000 in assets. So if you have any questions, call us. We will review the program with you. And if you want help filling out the forms, we can absolutely do that. And you'll probably even be referred to your local enrollment center to get help with that, where somebody can help you one-on-one.
Yes, absolutely. And that kind of just goes along. Jerry comments here that he used to have QMB, but he was cut off because they said his income went up. But he doesn't think that it did. So he's wondering if he can get on QMB again. And so, first of all, Jerry, I'm sorry that that happened to you. And we can assist you with better knowing what happened, if there's any letters or any communication that came. Now, these Medicare savings programs, they are the eligibility and the enrollment into them, I guess, does go through the FSSA, so the Family and Social Services Administration. So they do make the decision on the eligibility and the redetermination every year of that program, of these programs too. But we are more than happy to help you reapply or help you better understand what you may think your eligibility is. And sometimes we can even help you communicate with FSSA if that is the need as well, just to better understand what's going on. So, absolutely, we'd be more than happy to help you. And Susan, please add anything to that.
Yeah. And, sometimes, Jerry, things get flubbed up. And people get cut off of benefits through no fault of their own for really no reason. And that's something that we would for sure look into. If you appear to be income and asset eligible and you live in Indiana, then we got to figure out why you were
Right.
cut off of QMB. And, if you were cut off of QMB, then hopefully you got the next level. So at least your $175 Part B premiums still aren't coming out of your Social Security check.
Right.
And we need to make sure that you are segued into the appropriate level of the Medicare savings program. So while, like Melanie says, we are not the decision makers and who gets approved and who doesn't, we can help you solve some of those problems, or at least get you the information so it's clear to you. Sometimes the
Absolutely.
letters we get from the government are a little confusing.
Yes. Yes, they can be. Well, this has been, I'd say, a very informative and informational Ask the Expert. And Jerry is commenting here. Jerry, I think it would be really beneficial for you to give us a call. I'll put that in our comments here soon, but it's also, it's 1-800-452-4800, and we'll get you in contact with a local counselor that can help you face to face or even just over the phone, to get you that help. But yeah, we would be more than happy to help you with that. So absolutely. And thank you for watching, to Jerry and to everyone this morning. I think we have answered the questions, and it was just very conversational. So it seems like everybody was very kind of on the same page with the different questions and coverages that they had. So we really hope that it was a benefit to you guys this morning. And Susan, did you have any other questions come in, or?
No, but I will say I haven't been looking at my phone, so that's all you, Mel.
That's okay. I got the Facebook covered. All right. Well, I think we will conclude today's and this month's Ask the Expert. But we do like to throw these in throughout the year. So be tuning in. We might have some more Ask the Experts throughout 2024. So Susan, I'll let you wrap this up.
Okay. Well, I'll add my thanks for everybody for watching. And remember, if you're watching this as a taped show, if you will, if you connect with us, whether it's on our Facebook page, whether it's on our website, we will answer your questions. So keep asking, we'll keep answering. Coming up this month on Facebook Lives, we're going to take Memorial Day off because Memorial Day would have been our next Facebook Live program. But seeing as how that is Monday, Melanie's going to make us something, a real cool visual graphic to post. So we will not be with you live on Memorial Day. But remember, mark your calendars for May 23rd at 6 p.m. Access Eventbrite registration right from our Facebook page or our website. And tune into the New to Medicare webinar. We'd love to have you, even if you're on Medicare and you're an expert in Medicare, you just may learn something new. And it's live, so it's interactive. You can ask us all kinds of questions. So 6:00 p.m. Eastern Time, May 23rd. And then we're going to be zooming into June, where we have several things planned, including a session on the Pathways for Aging program that's going to go live in July. That's impacted a lot of Medicare beneficiaries. We're going to do a deep dive into Part D of Medicare. Melanie's going to do that one. And other things too. So just keep checking us out and we'll love to see you.
Absolutely. Well, thanks again for tuning in, and we hope to see you next time. Have a great rest of your week. Happy Monday.